Hi guys, this is John Adamson, the Rehab Documentation Guru, and I am at an airport today, getting ready to fly to Ukraine and continue on our adoption journey for those that are interested. Today, what we're going to do is look at how to interpret a standardized test, and we're going to look specifically at one test. I'm going to do further videos in the future about standardized tests. Please forgive any background noise that you're hearing. But today we're going to look at a very standard test that PTs can use, one called the 30-second chair rise test. This is a look at functional strength. What we're going to be doing is looking at an actual example of documentation that I found related to this test and look at why is it a wrong interpretation of the test, and then we're going to look at how to interpret it rightly. So here we have a 72-year-old male who normally dwells in a community setting, and he's been referred to therapy because he's had a decline in function related to illness. And so let's look at the wrong documentation first. So the therapist documented, number one, chair rise test, 9 reps in 30 seconds. Okay, so that's accurate. Without pushing from armrests. Okay, and that's how you're supposed to do the 30-second chair rise. So that's a standardized way to do it. Indicates, now here's where we get into the wrongness of this interpretation. Indicates fair plus bilateral lower extremity functional strength in closed chain setting, being able to complete functional transfers with minimal assistance. Now, one thing you probably see is there is a disconnect between the fact that the patient did it without arms, but they required min assist. With this test, you're not supposed to assist the patient. So this was not performed in a standardized way. It's very important that when we do a standardized test, we do it the standardized way, the way that it was meant to be done. The other thing is that you cannot say that 9 reps in 30 seconds for a 72-year-old male indicates fair plus strength. That does not correlate. It's not a direct look at good, fair, poor, things like that for strength, and so it's not a proper interpretation. Now let's look at how the therapist might have interpreted the same test given the fact that this was a 72-year-old male dwelling independently in the community. Chair rise test, 9 reps in 30 seconds. Normal for community dwelling elderly men, 70 to 79, is 12.9 reps, placing the patient at risk for falls, demonstrating a functional weakness of the lower extremities. Now that would be a correct interpretation. When you look at psychometric parameters, which are basically research parameters that allow us to look at reliability and validity of a test for different criteria, one of the best things about the 30-second chair rise test is we have age normative data. And so we also have it based on community-based patients versus those that are institutionalized. Sorry for the increased noise. A whole group of kids is walking by at the airport here. So what is that going to tell us? Well, it tells us what normative versus abnormal is. And in this case, we see that this gentleman, 72-year-old, if he's normal, should fall in about 12.9 reps average to show that he is truly normal. And in this case, he falls short. And whenever somebody scores poorly on this particular test, that does put them at increased fall risk. And it does demonstrate a functional weakness of the lower extremities. That would be a correct interpretation. When you use a standardized test, one of the things that we want to do is correctly interpret it for the reviewer who doesn't know what the heck the test means. And by interpreting it, we can determine, is there something that needs to be done about it? If this 72-year-old male had done this same test, 13 reps, then we can say, well, he falls within age normative, not demonstrating a functional weakness. Therefore, weakness is not something we need to address. And in that case, it would probably undercut any therapeutic exercise that we might try to prescribe because there might not be a need. Now, TheraX would be done for things other than strength. But in this particular case, we do seem to have justification for TheraX. Anyway, I hope you found this helpful. If you like this video, please like and subscribe to my channel. And also, please, in the I can't speak in the comments section, if you have any suggestions for future videos, please go ahead and post on that. And please tell your friends about this channel because I'm hoping to help more and more therapists get paid for what they do. This has been John Adamson. Take care and God bless.